Hello. In this PowerPoint, we're going to be reviewing the medicinal effects of bee pollen on the body. So bee pollen is just a mixture of flower pollen is collected by worker bees and is usually mixed with honey, nectar, and the saliva of a bee, just kind of getting the digestive enzymes mixed with the flower pollen. When doing research for this, we found that the effects for bee pollen showed some help with acne, allergies, arthritis, asthma, osteoporosis, reduced effects of chemotherapy. Also, some studies showed there was reduced effects of obesity, also helping with blood movement in the blood vessels. The people who use it mostly, it seemed like, were people who had allergies or asthma, chemo patients who are on who have cancer and are going through chemotherapy, and really any other kind of miscellaneous usage that they would rather use bee pollen before going on to medication for their specific ailments. Short-term side effects for bee pollen is usually due to allergies, something with a mixture of honey. People start breaking out in hives, getting itchy in that area, lightheadedness, nausea, uh, difficulty breathing. Long-term effects were more taking a mass amount of bee pollen. You'll start seeing skin rashes, numbness, stomach pain, weight gain, and loss of appetite. People on blood thinners should not be taking this, especially medications like warfarin. Children and women who are pregnant should not be taking this, and women who are breastfeeding.
Because bee pollen has so many different effects on people, it's hard to nail down specific medications in which bee pollen could replace them. For instance, some people take bee pollen in order to combat allergies. Other people are taking it to reduce the effects of chemotherapy. So those would be two drugs that that bee pollen could help with. The mechanism behind bee pollen is not well understood. So, in regards to that, there is no standard dose to prescribe individuals. Therefore, they must consult their doctor and ask them what they think.
We reviewed two studies. The first study showed that there was improvement in getting blood to the brain in older adults and also decreasing the likelihood of thickening walls into the arteries. Bee pollen also shows it had an anti-allergic effect and some antibiotic factors. And also, burn wounds showed to have a faster healing time than not using bee pollen as well. In the second review over bee pollen, there was a show that bee pollen helped prevent chronic diseases, helped prevent heart complications, prevent diabetes, prevent obesity, and also showed that there was improvement in overall health with just short-term uses. Long-term uses showed, as the first review showed, increased improvement in blood circulation and in turn improvement in immunity as well.
Our recommendation for bee pollen, as with any supplement, we would advise our patients to first consult their doctor before adding this to their regimen, just because there can be potential side effects, as with warfarin or any supplement. So we would recommend speak to their doctor right away, and if they are going to do it, to start small and to monitor their symptoms, because there can be instances where people have an allergic reaction to this and can go into anaphylactic shock. So be careful, no pun intended. Talk to your doctor.